Okay, this lecture is for the Topics in Human Biology module, and we're going to cover the principles of ultrasound in human imaging. So in this session I'm going to cover how ultrasound works, and to briefly summarise it, ultrasound is a pulse echo technique where pulses of ultrasound light are sent into a patient via a transducer. As these sound waves encounter different tissue types, then the sound wave alters its speed, and we call this acoustic impedance. And when the boundary of one tissue type changes, so from fat to muscle or muscle to fat, or from a fluid-filled cyst to some connective tissue, there's a large change in the density of the tissue which creates an echo, and that echo bounces back to the transducer and it is detected. And because we know the speed of sound, we can calculate the time it's taken for the sound wave to leave the transducer, hit the tissue boundary, bounce back, and that will give us an indication of tissue depth, which then allows us to build a 2D image of different tissue structures. So what I'm going to do in this session is cover the theory behind how this works to get to the point of being able to understand how ultrasound is used to image different structures. So first we've got to learn a little bit about sound waves, and sound waves carry energy. They don't carry any matter or anything like that, they're just purely carrying energy from one place to another, and this is via mechanical disturbance or vibrations. So sound waves are effectively the passing of energy from one particle or one molecule to another, and this allows the energy to travel in pulses through that particular tissue or that particular material, and different materials have a different speed of sound, which will become really important later on. And because there are no particles or molecules in a vacuum, sound cannot travel within a vacuum. And the sound wave itself runs parallel to the direction of propagation. So if we've got a point going from A to B, we've got the sound wave itself is parallel to this, and we'll see this on the next slide. And when we're dealing with ultrasound, we're dealing with very short wavelength sound. So medical ultrasound deals in the 2 to 15 megahertz range, whereas humans can detect up to a maximum of 20 kilohertz, so 20,000 hertz. Now this little link here is really good for annoying your neighbours. You could click on that link and listen to different sound different sounds at different frequencies, all the way from very, very low frequency all the way up to way above human hearing. And if you play this on your computer, play it very quietly, because you may well find that other people find the very high-pitched noises A, really unpleasant, and B, if they are younger than you, they might be able to hear things that you can't hear. But feel free to have a play on that to get an idea of hertz. When you actually watch this video, for the first few minutes you won't be able to hear anything because the wavelength is so low, and then as it starts to build, you'll start to hear a bit of a vibration, very, very low frequencies, and then it gets up to the really unpleasant sounds up at the 10, 15 kilohertz, and it's really, really quite unpleasant. But watch that if you really want to. So hertz relates to the number of times a sound wave passes a particular point within a second. So if one wave passes per second, that'd be 1 hertz, and if 1,000 waves pass in a second, that'd be 1 kilohertz, and then you can go up to the megahertz where you've got 1 million passing per second. And hertz can be related to wavelength and speed, as we're going to come across in the following few slides. So we'll go through the theory of hertz, wavelength and speed of sound fairly shortly. So there are lots of different properties of waves that we're going to cover. Frequency related to hertz, amplitude related to the height. We'll cover intensity later on. Wavelength is the distance from here to here, which is intrinsically linked in to frequency, because a longer wavelength will have a lower frequency. We'll talk about speed and power as well as we go through this session. So firstly, frequency, the number of wave cycles per second. So this is hertz. So 1 hertz is 1 cycle per second. Now if we're dealing with tissues, there's a magical number of 1540, and that is that the speed of sound through human tissues is 1540 meters per second. So if you have some sound where the wavelength is 1540 meters, then that would be 1 hertz. Now obviously we're not going to be dealing with 1 hertz because that 1540 meters is almost a mile, but we can use this magical number and to relate back to what is the wavelength of an ultrasound wave, which we'll do fairly shortly. So what you need to be aware of is the frequency is inversely proportional to wavelength. So very low frequencies will have a very long wavelength, and very high frequencies will have a very short wavelength. So the speed of sound varies depending on what the medium is that the sound is passing through. It's determined by the density of the medium. So low density, such as a gas, you've got a low speed of sound, whereas something like bone, which is very high density, has got a very high speed of sound. For most tissues that we're going to be dealing with is 1540 meters per second. So for fat, muscle, general tissues, it's going to be roughly this number. And this number is the basis of all diagnostic ultrasound imaging calculations. So this slide helps to illustrate how wavelength and frequency are related to hertz. So our speed is just frequency multiplied by wavelength, and we can rearrange this to then look at a specific example. So for example here, if we have a 7 megahertz source, that will have a wavelength of 0.2 millimeters. Now we can show that this is the case using the following set of calculations. So the speed of sound through tissue is 1540 meters per second. Therefore, if we have a wavelength of 1540 meters, that would be equivalent to 1 hertz. Using that, we can then also say that, well, let's reduce this by 1000 to 1540 millimeters. That would be the wavelength of sound for 1 kilohertz, and we can reduce this by a factor of 1000 again. 1.54 millimeters will be the wavelength for 1 megahertz. And then we could take this number, 1.54 millimeters, divide it by 7 and get 0.22 millimeters, and that would allow us to calculate that a 7 megahertz ultrasound frequency will have a wavelength of 0.2 millimeters. So why have we actually gone through this and calculated this? Well, the reason why we need to consider this is we cannot resolve anything that is smaller than the wavelength. So if we're using ultrasound to look for very small structures, we need a frequency and a wavelength that allows us to resolve structures of this sort of size. So if we use sound at 1 megahertz, you would have a lower resolution. You would see a much more grainy image. You wouldn't be able to see the fine detail. So this is why medical ultrasound uses sound waves above 1 megahertz, and that they're much higher, 15 megahertz, you get an even better resolution. Okay, so some of the features of waves that we need to briefly consider, and that's the strength of the sound. And this is the amount of energy that a wave will carry, and that can be measured in watts. So this is related to the amplitude of this wave. So a high energy wave will have a greater amplitude here. And if you've got a large amplitude, you've got more energy, you can disturb more of the medium, so you effectively get a louder sound. And that might be necessary to get sufficient echo to be able to actually detect what we're looking for, particularly in more deeper tissues. So if you've got more waves, you've got more power. So you can double the number of waves and double the power, but you can double the amplitude and increase the power by a factor of 4, this is squared. If you triple the amplitude, you'll increase the power by a factor of 9. So the sound waves can have a larger amplitude, and that can be used to increase the number of watts of energy to displace more tissue, to vibrate more tissue, and to get the signal that is required. So I mentioned resolution briefly on this slide. So we want to be able to resolve detail, and we need a wavelength which is smaller than the thing that we are trying to resolve. So resolution, when we're dealing with ultrasound, we're dealing with lateral resolution, that's objects which are side by side, and then axial resolution, which is objects that lie above each other. So if we've got something and then something else behind that, that's a millimetre behind it, we need a wavelength which is less than 1 millimetre to be able to separate those two objects or things, or whatever, those two layers. And also related to this, and related to the previous slide on strength of sound and power, we've got to consider the depth of penetration. If we're dealing with something that's very, very superficial, then a low amount of power may be able to get enough sound waves to hit that structure and bounce back. Whereas if you're dealing with something very, very deep within tissues, you're going to have to increase the amount of the number of watts of energy that are used. So either more sound waves or a greater amplitude, and that will result in a larger echo, which you can then detect at the detector. Okay, so we're going to look at the ultrasound probes now and look at how they work. So all of the ultrasound probes are effectively piezoelectric crystal based, and they all work in the same way, in that you use electricity to distort a piezoelectric crystal. That crystal will distort and emit a sound wave, and then that crystals in the detector will then receive a sound wave which will distort those piezoelectric crystals, which will then create an electrical current which will be measured as a signal. So all ultrasound probes use the piezoelectric effect, and you will have come across the piezoelectric effect or piezoelectric crystals we're in the labs, where you see people light a Bunsen burner with a little device. You pull a trigger and it creates an electric spark. Well, that's a piezoelectric crystal, and what you're doing there is you're pressing the trigger, you're distorting the crystal. That crystal then creates an electric charge, and that's what's used to create the spark to light the gas. What we can do is apply electric field to the crystal, cause it to change its shape, and as it changes its shape, that causes a pressure wave, and that pressure wave, it is what is then transmitted into the patient. So we have an array of piezoelectric crystals. We apply electric current to them, they distort in shape, that results in a sound wave being fired, and so that is the ultrasound that is entering the patient. And then we are using that process in reverse to generate the signal. And I'll come on to that later, which is called the reverse piezoelectric effect. So in terms of generating the original ultrasound wave, we use alternating voltage, which is applied to the piezoelectric crystal. This alternating current oscillates at a set frequency for a particular voltage. We can set the amplitude based on the amount of power that goes into that crystal, but that will cause a mechanical sound wave to be transmitted into the patient. So on this array here, there may be 128 or 256 individual piezoelectric crystals, and they will be fired in turn to give a series of sound waves fired off in this direction, and then those sound waves will be reduced back by the transducer, and they will be detected using what we call the reverse piezoelectric effect. And this slide explains the reverse piezoelectric effect. So the sound enters the body, hits some structure, echoes back, and heads towards the crystal where the sound started from. As the sound wave hits the crystal, that slightly compresses the crystal, causing the molecules to change shape, and that produces a tiny electric voltage which can then be used as a detector for the receiving of sound waves. If you get a larger echo, you get a larger voltage produced, and then we can apply that onto a two-dimensional image to create a grayscale picture, and that will give us a image of the structures that are present, with the structures which are closer to the detector typically, not always, but typically being at the bottom of the image, and then things that are further away up at the top of the image. And this image is built up by the time delay, because we know how long it's taken for a particular detector, a particular piezoelectric crystal to fire. That sound enter the body, that sound comes back maybe as a series of echoes, and then that is converted to voltage, and that's converted to an image. So we can't get an image unless we get echoes coming back to the detector. And to get echoes, we need differences in density of tissues. Now, all different tissues have different densities. Some are very similar, so fat and muscle are not really that different, but they're different enough to create an echo. So the more dense a tissue is, the harder it is to move the particles within it. So if you fire sound waves at fat, it's not particularly difficult to vibrate that particular tissue, whereas it's much more difficult to vibrate bone, because bone is a much denser tissue. Now, we get echoes where we get a change in acoustic impedance. So when you go from fat to muscle, there is a noticeable difference in density. Not a huge difference, but it's noticeable enough to then create an echo. Similarly, where you go from muscle to bone, you get a huge echo because there's a huge difference in acoustic impedance, and therefore you get a large echo. Equally, if you go from water to tissue, you get a very large echo as well. And this is the basis of why you see cysts and amniotic fluid as being black, because there's no echo coming from the water or the liquid, but then there is an echo coming from the boundary where that water is in contact with tissues, and we'll see that in a moment. So these are some of the main tissues with their acoustic impedance, and the acoustic impedance also known as Z. So bone is very, very high, but we've also got a very high speed of sound. For muscle, one of the more dense tissues, and a slower speed of sound compared to bone, but higher than the average for soft tissues. As you can see, water is less dense, a lower speed of sound. Air is very, very less dense, and the speed of sound is very, very slow. This is the standard speed of sound in air. So as you can see, sound travels through the human body much faster than through air. So as I mentioned earlier, if you've got a difference in Z, which is related to the density, the speed of sound will suddenly change as it goes through, transitions from fat to, let's say, liver, and that difference in Z results in a sudden change in the speed of sound, and that often allows a proportion of the sound energy to be reflected back. Rather than penetrating that tissue, you get a reflection back. And those reflections are what we are detecting. So reflection, this occurs when the ultrasound beam hits an interference between two different tissues, and those different tissues have a different Z value. If they have the same Z value, you will not notice anything on the ultrasound. The sound waves will go through one tissue with one Z value and go through the next tissue, if it's got the same Z value, without creating any reflection. But the size of the difference in density determines the size of the reflection. If you go from a very low density to the very high density tissue, you'll get a large reflection sent back, and that will be a very bright image. And the best way to think about this is, everyone's heard an echo. If you are in a canyon and you shout, the sound waves will travel through air. They will hit the rock. The rock has got a very, very high Z value, so almost all of that sound will bounce back off that rock and you'll hear it as an echo. Whereas if you shout at a cloud, which has got around the same density as air, the sound will just travel straight through the cloud. Now the same sort of thing is true in the human body, it's just that the Z values are not quite as extreme as air to rock, but the same principles apply. So when looking at this table, you can see that air has a Z of 0.0004 and fat 1.38, and that's a huge difference in Z. So if you were to fire sound at the human body, almost all of it would bounce straight back at the detector. To prevent that from happening, we apply gel to the ultrasound detector, and this gel has a density very, very similar to that of human tissues. So the sound waves go from the detector through the gel and into the human skin with virtually no change in Z. So the gel and the skin, the Z1 and the Z2 are equal, and you get 99 to 100% transmission of that sound wave into the body, virtually no reflection. Whereas if you just use the transducer without gel, it would all just bounce back. We can then see what happens when we image different tissues. So in this situation we could be looking at fat versus muscle, or we could be looking at soft tissue versus a water fluid filled cyst. So as the sound waves enter the body, they've gone through skin and they start going through fat, and then they hit different striated levels of muscle. Each time the sound wave hits a different striated layer of muscle, you'll get little reflections going back. So if you look at striated muscle on ultrasound, you'll see a series of lines, and those are little echoes for each individual layer of muscle, and then maybe you'll get a big reflection as you then move into a different tissue. And you can probably see this here. So this is the ultrasound probe is here. This is the surface of skin. You've got multiple reflections going on here as the sound wave is going through muscle and bouncing back to the detector. And then what we're doing is looking at a fluid filled cyst. So the sound wave has gone through skin, it's gone through muscle, there's been little reflections going on, and then the sound wave enters the fluid, and the fluid is very low density, so there's no reflections at all within the fluid, so there are no echoes, so the fluid looks black. And then the sound waves hit some connective tissue on the far side of the cyst, which is here, and then you get a very large echo because a good proportion of that sound hits that boundary. We've got a very low Z liquid and we've got a higher Z tissue. That's created a large reflection, and the sound wave will have been sent back, which is sort of shown here. So we've got, so going from the transducer here, we've got 100% of the sound enters the skin, small amounts of it bounce back to give this series of layers, then what sound is remaining enters this cyst, goes straight through the cyst because there's nothing to reflect, hits the far side of the cyst, and then bounces back. So this is the sound that we see heading back to the detector. So the detector will detect the closest layers of muscle first, then this one, then this one, then this one, then this one, and then there'll be a large gap before we receive this large signal of sound bouncing off the edge of this cyst. And then there would be another large reflection there, there, and there. And that's how we build up the image. We can take the Z to the extreme here, where we've got tissue and bone. So Z1 of tissue is very, very low compared to bone. So here we've got an ultrasound image, and we've got various levels of tissue here. So this is skin and muscle, so you've got maybe different layers of muscle and fat going on, and then we've got this sudden bright layer there, and that is where the sound waves have hit bone and almost all reflected back. So like in the previous slide, we'll have got something like this going on to generate these layers of fat and tissue here, but then when the sound waves hit the bone, almost all of it has hit the surface of the bone and bounced straight back. You see that the signals from this bit of sound that's penetrated the bone is incredibly weak down here, and that's because 99% of the sound has hit the surface of the bone and bounced straight back. So we can't visualize things within bone, beyond the surface of the bone, using ultrasound, because the sound just does not penetrate the bone. You get a hypo echoic signal behind the surface of the bone. We also refer to this as a hypo echoic signal as well, because there's basically hypo echoic, there's no echo. So where we've got differences in Z, we've got differences in reflection, and we can have an intensity reflection coefficient, and this goes between 0 and 1, where 0 is no reflection and 1 is complete reflection. And what we see is if you go from fat to muscle, the Z values are similar. You get an internal reflection coefficient of 0.01, and that relates to 1% of the sound energy being reflected back. When we go to a situation where you've got muscle and bone, you've got a very large difference between Z here of about 7 to 8 and here about 1.6, and that might result in 40% of that sound being reflected back just from the surface of the bone. And if we're dealing with air and soft tissue, there's an almost 100% reflection of that sound. So as the sound wave travels through, say, the lung, hits a structure, it will just all bounce back. So what effect does this have on penetration? Well, we can get ultrasound to penetrate through tissues quite well if the tissues are of a similar density, and the waves will travel through that tissue quite a long way because there's very little causing them to reflect back. But then if they hit bone, the sound waves will not get any further than the surface of the bone, and the vast majority will be reflected straight back. If we're dealing with soft tissue and air, such as imaging the lung, as soon as you get an interface between air and tissue, you'll get a reflection of almost all of that sound. So here are various tissues. We've already seen bone, we've seen the sound waves coming this way, hitting the various striated levels of muscle and fat, and then hitting the surface of the bone, and almost all of that sound being reflected back. Here we can see muscle and different layers of muscle that each change in density is showing up as a white line, which relates to a reflection where one area of tissue has changed to another area of tissue with a different Z value. A fluid-filled cyst, the sound waves have come in this way, passed through the cyst because there's no reflection going on, so this is hypoechoic. Sound waves have hit the far side of this fluid-filled cyst, and then most of them have bounced back to create a very bright signal, and then some of them have penetrated that tissue, and then you get other reflections as there are different structures going on down here. So all different tissues reflect sound in different ways. So the effect of that reflection results in something called acoustic mismatch, where you've got Z's of different values. A large acoustic mismatch, so a large difference in Z, gives a very strong echo and a very bright image, whereas a small acoustic mismatch, very little echo, a very dark image, and that's what we call hypoechoic. And we use all of these echoes to determine tissue boundaries and be able to visualize them. But we need to know how deep something is, not just the fact that the sound bounces back. So how do we know how deep something is? Well, we use the speed of sound, and we know how long it was since we fired a sound pulse from the transducer, so therefore we can work out how long it takes for that sound to come back. We know that speed is distance over time. We know the speed of sound in tissue, 1540 meters per second, so the time is related to the distance, and the distance is speed multiplied by time divided by 2 in this case, because the sound's got to get there and it's got to get back. So that gives us the distance in depth. So something that's a long way from the detector, the sound will echo back later. And that allows us to build up the 2D pictures. Now the images are formed by a piezoelectric crystal array, and these are all in a line. If you just had one big crystal, you'd just have one, you'd be able to fire one sound wave at a time. So typically you have 128 or 256 elements in the crystal, and these can all be fired sequentially. So you can, so you don't fire them all at once. You fire one at one end first, and then fire one a little bit further down, and then subsequently another one. And you let one batch of ultrasound signals penetrate the tissue and bounce back, and then very soon after fire the next array and the next array. So you're sending sound, waiting for it to come back, and then firing the crystals again, but doing this in very, very quick succession. And that allows you to build up lines of image based on these 256 different elements. So I just showed you a few other applications. Everyone's seen the standard transducers that are used on the surface of the abdomen, looking in utero, developing fetuses, for example. We also have other transducers. So there's a transvaginal one, which is looking at the ovaries. So basically what we're wanting to do here is get the transducer as close to the ovaries as possible, and be able to, in this case, visualize a polycystic ovary. So it's a case of getting the transducer as close as possible to be able to see the detail there. And then in the for male patients who may have got prostate cancer, we use a transrectal ultrasound. So in this case, imaging the prostate. So the prostate is very close to the bowel wall, so you can use a transrectal ultrasound probe, press it up against the wall of the rectum, and within a couple of centimeters you're into the middle of the prostate. And in this case we're looking for very dense regions within the prostate, which are regions of prostate cancer. So ultrasound imaging, it's not just about imaging static structures like cysts and tumours. We can actually use the Doppler effect to use ultrasound to measure the speed of blood flow. So the Doppler effect, first described by Doppler, is being used, or initially, the Doppler effect was used initially to calculate the fact that stars were moving away from the Earth and they were redshifted. Because as things are moving away from you, the sound, in this case light waves, are effectively stretched and then redshifted, which might not be that important, but that's where the Doppler effect comes from. Initially a light phenomenon, but the same thing is true with sound. So you'll have all seen the Doppler effect with an ambulance either coming towards you or going away from you, and there's the ambulance is coming towards you. The sound waves are compressed because they are emitted from the ambulance, but because the ambulance is coming towards you at maybe 50 meters per second, that compresses the sound waves, so you've got a shorter wavelength and a higher frequency. And then as it's gone past you, the sound waves, if the ambulance is going at 50 meters per second in this direction, the sound waves that are heading backwards towards you are effectively stretched, so you get a they're not stretched, but you receive fewer sound waves per second. You get a longer wavelength, you get a lower frequency, and that's the Doppler effect. So we get compression of sound waves as something moves towards you. We get rarefaction, which is the opposite of that, when something moves away from you, and you get a lower frequency then. And we can use this principle to assess how blood cells move in a blood vessel in relation to the transducer. So if blood cells are moving towards a transducer, you get compression of sound waves. If they're moving away, you get rarefaction. And that can be used to tell you the speed of blood flow within a blood vessel and which direction the blood is going in. And this can be visualized in this way. This is an echocardiogram. So this is looking at blood flow in the various veins and arteries leading in and out of the heart. And In this case, if anything is heading towards you, it is in red. If it's heading away, it's in blue. So we're using the Doppler effect to calculate the speed of blood flow, and the colours represent the speed of blood flow. Okay, so I've covered all the theory of ultrasound. What I want you to do now, because this is the sort of thing I might ask on the exam, is using terms of acoustic impedance, Z, density, speed, intensity, internal intensity reflection coefficient, draw a diagram to outline all of the phase changes in imaging in this case, a polycystic ovary or just a fluid-filled cyst. So you've seen a picture of a polycystic ovary earlier. These are cysts. So what I want you to do is draw a diagram using all of these terms to explain why a cyst looks like this as a black dot, and explains why we get a hypo-echoic region. And then secondly, task 2, using the same terms, explain why ultrasound imaging of the lungs is problematic. It's not impossible, it can be done, it's just not very pretty. And also explain why structures behind bone cannot be imaged easily. So they're the sorts of things that we'll be discussing in the live session. But go back through the lecture and be prepared to come up with answers to these tasks. Okay, that's it from me.